So, I mean, that's a good question, Jeff. Getting a lot of that question from Kenyans. And so this is what the science from the manufacturers says, that they do advocate for you to take the COVID vaccine 1 month after you've recovered from COVID, COVID symptoms, COVID disease. So the idea is this, and, it may sound a little bit gray, but what we're saying is you are able to access the vaccine 1 month later, contingent on a clinician review. And so you would need a doctor to give you the green light to go ahead and get the vaccine. So you don't just rock up to a vaccination center. It would be prudent for you to have some clearance from your clinician. And when we talk to our immunologists, and particularly, and I want to thank Professor Gontier because he's the one who's giving me guidance in this. He's one of the revered immunologists within the country. He says that you want to safeguard against having an advanced immunological reaction if you introduce the vaccine into a patient who is currently actively having disease. That there is a potential of you elevating and getting sort of a larger immunological reaction than required. And so the evidence and the scientists seem to guide us and tell us that a month after is prudent for you to then come in for your vaccine, but all contingent on a clinician review and approval.
Okay, Dr. Mercy, let me stay with you on this next question. The person's name is actually Flat Screen. Can't make it up. Okay, Flat Screen is asking, Kenya has a population of about 50 million people. Today, very many people are being turned away from various facilities, which confirmed having run out of their stock after only vaccinating plus minus 167,000 people. Question is, what plan does the Ministry of Health have in ensuring supplies are enough?
So thank you, Flat Screen. We did address this today. It came up today in our daily presses. Yes, there was a transient temporary shortage yesterday, but that was really occasioned not by a shortage of vaccines because we have them in our stores, but a rollout of a redistribution plan, particularly because we expanded the phases of vaccination. We introduced those over 58 years old. And so what happened is that we were using our old distribution list. And yesterday, a correction was required, which we did. And I think I'm happy, particularly because I've seen it in the news today at 7 o'clock, 9 o'clock, that centers are back vaccinating, and those who haven't received their vaccines should be getting their vaccines within the next 1 to 2 days. So we have vaccines and they're available. Kenyans should be assured that we have not run out of vaccines yet. And we continue to encourage them to present themselves to the vaccination posts for the service.
All right. Let's hope Flat Screen is happy with that answer.